Hello and welcome to Bottom Line. With 500,000 COVID-19 cases across the globe, the pandemic is growing by alarming proportions, with even the most developed of nations unable to contain the outbreak. The United States, for instance, now tops the chart for positive cases with well over 85,000 people affected. This is over 4,000 more than that of China, where the pandemic first started. While the global death toll is close to 25,000, Italy alone has registered over 8,200 deaths, and the numbers are only rising. While several countries, including the US, are blaming China for this pandemic across the globe, at this juncture, it is perhaps also important to try and know how China contained the crisis in the first place, and could it have done a better job in as far as containing a global outbreak is concerned? Could China have played a better role in that? Yes, this is one question that nations across the globe, several nations across the globe are asking, including the United States of America. So we need to get a perspective of that from the Chinese side, and today in Bottom Line, we will have a guest joining us from Beijing. Is the foreign editor at Global Times, Shamim Zakaria. Warm welcome to you, Shamim Zakaria, for joining us at Northeast Live. Welcome. First of all, how is the situation now in China? While there are ample indications that things are back to normal, there are also reports that there are some people who had recovered are again testing positive. Shamim.
First, to answer your first question about situation in China, situation is moving towards normality in China, and the recovery rate outside the epicenter Hubei province is over 80% as I'm speaking with you. And of course, there has been some reports of all the people who have, not all the people, some people who have recovered tested positive, but that is also very slim. Not all the people have been tested positive. And to ensure that the people who have recovered and discharged from the hospital, they are not again test positive. So even after the people are cured and released from the hospital, they are kept under isolation and medical observation for another 14 to 20 days, depending on the severity of the illness. And apart from that, recently China, even though overall China, the overall situation eased, but the maximum challenge that China was facing was not domestic transmission, but transmission from the imported cases. For instance, people, Chinese nationals or foreigners who were traveling back to China, they were infected and they were kind of transmitting the infection. And to curb this, effective 28th March midnight, all foreign nationals, irrespective of they have visas or residential permit, they are totally banned from entering China. And this has been declared last night by the State Council, and they have done it in order to curb the overseas import of infection.
Shamim Zakaria, it would have required a mammoth effort to completely contain the pandemic. How did China manage to do it so effectively, we can say in a short period of time, given the extent of the spread? It was spreading over 80,000 cases, and now all of a sudden there are none. I mean, even in Wuhan, and also you have to accept that it didn't spread everywhere in China. So how did China pull it off? That is something that everybody wants to know as the entire globe, struggles to contain this crisis.
Yeah, absolutely. As you said at the beginning, that it took drastic and mammoth effort from all sections of the society, including the government, including volunteers, workers, and also the citizens, most importantly. And yeah, the steps were really drastic. They erected makeshift hospitals with 3,000 beds just within a week. And what I have observed from my personal experience is that the steps started from a very grassroots level. For instance, if I have to tell you about the place in Beijing where I stay, right when the pandemic, at that time it was an epidemic, right when the epidemic broke out and things started surging, the cases and death rate, what the government did was they enforced and they stationed security personnel in each and every residential community in all over Beijing, in all over China. And of course, as you know, that there was total lockdown in Hubei province and Wuhan epicenter, especially the city of the epicenter. And in other places, they stationed security guard and community volunteers. They were drafted in, and so every time a person comes inside or go outside, they have to submit to mandatory temperature screening. So if I say like small supermarkets, big supermarkets, or any other public places, if I have to enter, I have to go through a temperature screening. I have to give my passport number and detail of my travel history and all sort of details. And apart from that, also, as I said, in my community area, we were issued entry passes. So, for instance, if I go out for some urgent, requirements, before coming back, I have to show my pass. Only then the security personnel would allow me to come inside. And apart from that, they also launch hotlines because in Beijing or in China there are a lot of foreigners as well. So they launch hotline numbers to help the foreigners and to help people of other nationalities. And they, I think, launched the hotline in 7 or 8 languages. So this was kind of the effort, and it was, of course, possible because of the efforts of each and every person from all walks of life, including the normal citizens, the government official, and also community volunteers, most importantly.
No denying to that, Shamim Zakaria. Another thing that I would like to ask you is that has China also made any breakthrough in terms of any medicine or vaccine that probably those outside the country may not know of still? Why I'm asking you this because at the time of this crisis, the entire globe is still looking at China with disbelief. How could China contain the entire situation all of a sudden? So there are a lot of reports, there are a lot of theories. So do you know of any medicine, vaccine that probably the Chinese have and the world doesn't know about? Skeptical, but yes.
Well, of course, I cannot say you with authenticity because I'm not someone from the medical field. But what I have heard about the buzz here is that no, there is no such breakthrough. Of course, they are doing experiments and they are doing research and development. And right now, the last press conference that was addressed by the State Disease Control Board of China, they said that it is still in the stage of animal experimentation. So they are experimenting it on animal, and there have been no declaration as such as of now.
Absolutely. Now, Shamim, as somebody who was in China all along when this entire outbreak took place, which month, which day, which date was the alarm sounded? Because even till as late as February or February end, there was not much panic outside China. For instance, US President Donald Trump was in India on the 24th of February. So clearly, the world was still unaware that this kind of a pandemic may hit the globe because there was not much of a crisis. We had flights coming in, we had tourists coming in, we had a head of a nation coming in. So clearly the world was in the dark. What about China? Of course, we know that it started in December, but when was that alarm sounded that, guys, hey, we need to stop and wait, stay put wherever we are? When did that happen?
Yes, to explain this, I would say around December, there were some cases coming out, but people or overall in China, we were not aware about the magnitude of the infection and magnitude of the outbreak. But it was around the last week of January, because I remember I had booked my flights for Malaysia. I was supposed to take a holiday there, and my flight was scheduled for 26th of January, 10:30 at night. But around 25th, I think they locked down Wuhan. They completely locked down Wuhan, and they restricted the movement of people and vehicles. And at a later stage, my flight got canceled because other countries were also closing down their borders. And that's when the alarm sounded. And of course, when China enforced the lockdown, at that time in Wuhan, I think there were around 500 cases. But it was good because they did it at a very early stage. And, as you mentioned about US or other countries, especially US or even in Italy, at the beginning of the outbreak, they took things very casually, and today you can see the impact. Like Italy has surpassed China in terms of the number of deaths, and also in U.S. also, I think it's in the second stage now. That's because at the beginning they were taking things pretty lightly. They had a pretty laid back attitude, and that's the reason you can see the consequences now.
That brings me to my next question, Shamim. Laid back attitude. You are saying there is also a rising accusation against China that it did not share vital information about the outbreak on time. Even till January end, China was claiming that there was no human-to-human transmission. Even the WHO, the World Health Organization, as we all know now, had tweeted the same. The world now is asking questions to China. The question is that, did China, we are not saying it's intentionally, but was China a bit laid back when it came to passing on the information to other countries across the globe? Did China delay a bit in informing that yes, there was probably a human-to-human transmission, and all of us need to be very careful? In that case, all the flights, people moving in and out would have perhaps stopped. Or are you saying that even China did not realize it, and so there is no use blaming it for the situation now? Shamim.
Navarun, I would beg to differ on that note, because what I have personally noticed is that China has been sharing all experiences about treatment, about diagnosis, and also about all the information. And at the beginning, the reason why China didn't sounded an alarm was that even people here, the scientists or the researchers or the epidemiologists, experts, they were also uncertain about the magnitude of the infection. So they didn't do it because they were still at a very early stage, and they're trying to look at it like, is it airborne, or is it like human to human? Is it transmitted from human to human? Because it is at first when the outbreak happened, they said that it is a SARS-like virus, and SARS, as we know, that sometimes it is airborne. But when it comes to this virus, this is not an airborne virus, but this transmits from human to human. So at the early stage, even though they said that because they didn't have enough data, they did not test enough people, and there was lack of data. So that's the reason they didn't give any declaration. And speaking about WHO, so there was no case of hiding or concealing of information from China, because WHO officials themselves came to China, and even China invited experts from the US who joined in the panel of WHO, and they came to China, and they even visited the epidemic hit and worst affected provinces to take a stock of the situation. And speaking about sharing data, even yesterday, I think until yesterday, when I attended the press conference of the State Council, they said that around 25 video conferences have been held with different countries around the world. And China has sent experts to countries like Iran, Spain, Italy, and even they said that if US is ready to accept experts or ready to accept experiences from China in terms of treatment and diagnosis, China is ready to do that. So in terms of research and development and sharing information, China has been doing their utmost at this stage.
China did its best, you said. Shamim, my next question, I ask it a bit skeptically. There are also conspiracy theories doing rounds that China may be hiding the actual number of casualties. Is there any truth to these?
Well, as you yourself said, it's a conspiracy theory. So conspiracy theory best looks good as a conspiracy. And apart from concealing the facts, well, as citizens or as residents of a country, apart from believing what the government says, do you have any other means to go and validate that? I don't think so. We do, because whenever there is death or there is the death toll, whatever data is shared by the government, that's the only data you have. So I think these are just like conspiracy theory and rumor mongering being paddled across. And, as journalists, we know that when it bleeds, it leads. So whenever it is something sensational, it will travel faster. And that is the reason I think all the conspiracy theories and rumor is being mongered all across.
A lot of theories doing rounds. We all know that many nations, several nations rather I should say, even the United States want the COVID-19 to be named as a Chinese virus or Wuhan virus, thus again blaming China for the outbreak globally. Again, trying to indicate that if China would have wanted, it could have done much better as perhaps information sharing is concerned. This has turned into a political issue also, and we are all aware of that. How do you react to this, Shamim?
Sure. Well, I would say, just to you weigh in on your question, I would say that U.S. is allegedly blaming China and shifting the blame to China to hide their own incompetency, I would say, because the first case in South Korea and the first case in U.S. was detected on the same day. But U.S., instead of testing enormous number of people, doing large-scale tests, they were telling people that unless you have been in close contact with a positive, some patient who have tested positive, or you have traveled to virus-affected region or countries, you are not supposed to take the test. So that is the reason, I think. So that is the reason why the number of infection and death rate has surged. But whereas if you look at South Korea, they have been able to contain the outbreak quite effectively and efficiently. And about the blame game, if you go by WHO guidelines, it's strictly mandated that when they name a virus, it is not supposed to be named after any geographical location, after any human being or any animal. And if U.S. Or particularly, I would say the U.S. administration and President Donald Trump, if he's trying to do that, it is absolutely a xenophobic slur. And at this time, the countries, and because it is a pandemic, so I would say all the countries and regions should come together and join hands. And the main goal should be how to contain this pandemic and how to get rid of this, rather than peddling this sort of xenophobic slur, because this has kind of created a problem for the overseas Chinese. Because I know a lot of overseas Chinese, my friends here, or like my acquaintances who are based overseas in other countries. They are based there, and they are like as students or working. They are at the forefront of a racism. They're facing racist discrimination because of some fatuous attitude of some politicians. So I would say this is not the right time to do this. And the name of the virus has already been finalized by WHO, and they have named it as COVID-19. So there is no question of naming it after any country, because the guidelines strictly forbid doing that.
Probably because we had names called Ebola. We still have Japanese encephalitis. So let's duck that for now. All said and done, Shamim, what role can now China play to help the rest of the globe emerge out of this crisis? China, after all, has apparently successfully tackled the situation and will surely have lots of best practices and steps to share. So can China lead from the front now, really, and can that action be seen on ground?
Well, as of now, I think the primary role that China can play is share their experience, because Absolutely. At the beginning, you yourself admitted that China has put enormous effort, and within 2 months, China has been successfully achieved 0 infections. And even in epicenter Hubei, I think yesterday they completed a streak of 5 consecutive days of 0 infection. That is all because of citizens' effort, isolation, massive testing, and all the draconian measures, which might sound draconian, but of course that was important. So I think at this moment, China can share experiences, treatment experience, or experiences in terms of at the community level, what China did, how it succeeded in achieving that, and it can share the experience with other countries and help other countries enforce similar measures in their own countries and help contain this virus outbreak.
Absolutely. And how do you think is, if you're keeping a track of it, how do you think is India dealing with the situation right now? We are the second most populous country in the world after China, and of course there's also a difference in resources of both nations, but as far as the numbers are concerned, India, as of now, we have just we have touched the 800 mark as far as the confirmed cases are concerned. 20 deaths reported. Figures may not look too big for a country of 1.3 billion, but nevertheless the situation is critical. But do you think India, with its resources and the efforts that it is putting in right now, do you think India is doing a good job as far as trying to tackle this crisis is concerned?
Well, at this moment, I think India government has been doing pretty good. They have enforce the 21-day lockdown. And of course, in terms of resources, in terms of logistics, it varies. But at this moment, I would not want to give any immoral, any kind of statement that kind of harsh the efforts. So I would like to boost the morale of the India government, and I would say definitely as Indians, as a government, now it's time to rally behind the government and show support. And this is very important at this point, that as citizens we should be aware. Apart from the measures like wearing masks, frequent washing of hands, it is very important that we maintain social distancing. And as you rightly said, that India is the second most populous country after China. So in such a when there is such a huge number of people, it becomes extremely important that people exercise precaution. They don't go out unless it is very necessary. And even if they're going out, they should wear masks, or if possible wear gloves, and basically need to be self-aware and exercise self-restraint and self-isolation, and also social distancing. And I think if these steps are enforced and people are coming out and people support the steps of the government, definitely India will be able to tame this outbreak.
Absolutely, Shamim Zakaria. Thank you for your valuable perspective in giving China's part of the story to us at a time the entire globe is struggling to deal with the crisis. This version, this perspective that you gave was very important because a lot of conspiracy theories are doing the rounds. Several countries are also at the same time blaming China for the situation, but it's also important to know how China feels about it and what kind of efforts China has been putting in. Of course, we are all entitled to our views, opinions and assumptions. Nevertheless, it is important to know what the neighboring country feels. Shamim.
I would just like to make a statement that whatever I'm saying, I'm not saying as an expert. And even if I have quoted some expert advice or some data, I would request the people or the viewers of Notice Live to not believe me straight away and go and check your own facts. Because at this moment, in terms of when there's an epidemic, with it, there is another problem, that is the infodemic. So it's very important to cross authentic data. Don't believe on inauthentic information. Go to WHO website or government website, and only after that believe on the data. And secondly, whatever I'm saying, it's my personal view, and my views do not reflect the views, or it is not endorsed by my employer, Global Times in China.
Nevertheless, they were very crucial for us because not much information comes out of the country called China. So it's very important to also get the view of how the nation, how the Chinese feel about it, what the Chinese think, what efforts they have put in. China has put in a mammoth effort to contain the pandemic. Yes, it can definitely play a big role globally, and that's what the world is waiting for now. Yes, there are political differences, and that will always remain, but this is the time to unite for the cause of humanity, and I hope the Chinese do the needful. Thank you so much, Shamim Zakaria, foreign editor at the Global Times Beijing.
Thank you so much, and I wish I wish health and safety to all the Indians, and we'll definitely together in this, and we'll overcome this challenge.
Thank you, Shamim. Thanks a lot.